you ever heard of the lady with the lamp? Sounds kind of silly, but the woman that I'm going to talk about today helped to revolutionize modern nursing. My name is Abby. I'm actually a registered nurse here in Tyler, and today I'm going to talk about Florence Nightingale, her implementations of modern nursing that's used already today, her achievements and statistics, and how both of those were implemented during her time in the Crimean War. First, we'll talk about her modern nursing achievements. One of the biggest things was hand hygiene, so I'll talk about that. An online journal of issues in nursing posted an article on May 31st of 2021, written by Jennifer H. Matthews and others. She quoted, "Nightingale implemented changes and improvements in nursing practices and patient care, achieved outcomes and overcame barriers. The ultimate goal is to optimize patient care and individualize care delivery to attain health for men, women, children, and the family in the context of their communities." Another big thing, like I said, was hand hygiene. This was the biggest emphasis that Florence Nightingale made, and it is used in healthcare settings even today. Hand hygiene is one of the most important things in sterile technique used in major procedures and surgeries. And so thanks to Florence Nightingale, we can decrease the amount of infection and spread of diseases with hand hygiene. In addition to that article, she also wrote, "Her ingenuity to ensure adequate nutrition promoted healing, thus reducing wound infections or development of chlorea and dysentery." Most kitchens back in the time of Florence Nightingale were not properly maintained. Florence made an emphasis on ensuring that adequate kitchens were kept clean and utensils were clean to ensure decreased risk of spread of infection between soldiers and other medical staff. This process ensured that they also had nutritious meals and helped in the healing process. Now that we've talked about her implementations of modern nursing, let's talk about her achievements and statistics. In the National Library of Medicine posted an article on October 5th of 2020 by Danu Demetriou and others. They wrote, "She emphasized the importance of numbers, an example of statistics in healthcare, providing number of beds, patients, cases, etc. These data served her to take decisions in regard to hospital administration and public health measures." She collected evidence on outcomes and other practices that helped influence modern nursing today. Her findings showed improved conditions of hygiene and cleanliness, which also decreased the rate of mortality in soldiers. In addition to that article, she also stated her statistical analysis provided critical insights into the effectiveness of medical interventions and the impact of environmental factors on patient health. Again, proper technique of hand hygiene and the sterile procedures are revised and revolutionized year by year, and today we are at a very low rate of infection when it comes to major surgeries. Proper cleaning of beds and rooms also in hospitals has also shown a decrease in infection and spread of diseases. So now that we've talked about her statistical findings and her implementation in modern nursing, let's talk about how she used both of those in her time during the Crimean War. The National Library of Medicine posted an article on August 5th of 2024, and it was written by Yana Turkowski and others. They quoted, "Nightingale presented statistical data on mortality rates among wounded soldiers in military hospitals, specifically through careful analysis. She demonstrated that the majority of deaths were not due to injuries, but rather to preventable diseases such as typhus, chlorea, and dysentery." COVID-19 is a big example of that, and we're able to prevent the spread of diseases with proper PPE, which has also decreased the number of COVID cases. In addition to that, her analysis and implementation improved the decreased spread of diseases not only in hospitals but worldwide. In the same article, she also wrote, "Her innovative approach to data analysis paved the way for evidence-based medicine and epidemiology, emphasizing the importance of empirical evidence in guiding medical decision-making. Analysis not only helped in the Crimean War, but it's also helped today every single day in the hospital." We can look back and appreciate all of those times where she stood with that lamp and thought and analyzed all of this data to improve our nursing and our healthcare today. So now that I've talked about her implementation of modern nursing and how it's revolutionized today, I've talked about her achievements in statistics, and I've also talked about how she used that in the Crimean War. So I'll give you a last little bit. Every time you pass by a lamp, you think about her and how she helped to revolutionize your care today. Thank you.